turn it over to Dr. Vines.
Hi, good afternoon, everybody. This is Dr. Jennifer Vines. I'm the Multnomah County Health Officer. I'll turn it over to my colleague, Kim Taves, in just a moment. Just a high-level overview. I know there's a lot of interest in the spike in cases that we had over the weekend. I will just say again, we've expected case counts to go up with reopening and as people socialize more. Again, our goal in this pandemic, and especially locally, is to make sure that we minimize the number of people who are hospitalized and hopefully the number of people who die from this virus. So those are our broad overarching public health goals. I also want to emphasize that what you'll hear from Kim shortly is that we're seeing spread in really close social networks, some related to work sites, but it's really a close, tight-knit family, household, and social networks where we're seeing spread. So you can help us carry the message to people that as we reopen, there is still no vaccine, there is no reliable treatment for this virus, and so prevention is still going to be the key for the next several months. And I think people may be lulled into feeling more at ease, understandably, around people they know well, but that's really where the face coverings, good hand hygiene, limiting the number of contacts, especially for our frail elderly, is going to be really important. So if you could help us carry those messages, I'll turn it over to Kim Taves now to introduce herself and to share a bit more about what we're seeing in Multnomah County.
Hi, good afternoon. My name is Kim Taves. I'm the Communicable Disease Director for Multnomah County Public Health. We do have folks, as you all know, doing case investigation and contact tracing every single day, 7 days a week, and that has been true for the entire pandemic. So there's usually a couple days of a lag time between when cases get reported to us and when we've been able to reach the person, interview them, identify their household, their type of work they do, link them to other worksite settings. So if we have a jump in cases one day, we may not have a full set of answers for you all by the next day. And we know that there's variability from day to day. For example, we had a very large number of cases on one day this week, and then in the most recent 12 hours, we've only had 17 cases reported. But we are aware that even if there's up and downs from day to day, that we are in a state of an upward trend, not only in terms of case counts, but also in terms of the positivity of the testing that's done. So let me answer a couple questions, probably 3 or 4 questions that I've gotten most commonly that I can imagine you might have today about case count, and tell you what we do know and when we might expect to know more. First of all, there's not one single large outbreak that's occurring right now. We have had in different counties and even in our own county a couple different times where we had a particularly large outbreak in a work site or a residential facility that was really driving numbers for a week to 2 to 3 weeks. That's not happening right now. We do have an increase in small numbers of connected cases in worksite settings. Most of those worksite settings have 5 or fewer cases that are linked, so not on the order of 50 or 60 or 80. But the worksite setting that we have consistently prior to reopening as well, because it was an essential service, so it's been open the whole time, where we have seen a number of cases in a number of different work sites of one type would be the food processing businesses. And I think that's in part because people are in very close proximity, and in part because people are working around machinery that's used to process food. It's not quite as malleable an environment or a work structure to change to give everyone full spacing. So they've been relying on doing what they can to space folks out, to use appropriate PPE, but there have been a number of different small to medium size, and then maybe one that was significantly larger outbreak in food processing businesses. So what happens there is that there tend to be certain communities that have more proportion of folks who are those essential workers. And if there is spread between some work staff, people are often bringing the infection home to households, especially larger households where multiple people are living together from multiple different generations. And then from there, we're seeing some spread amongst the household and then into a tight, cohesive social network. So it's not necessarily that people are then going to a grocery store and transmitting, or then going to a different work site, or then going to a church, for example. It's more those people's like organic social networks of having larger extended families and close family and friend contacts. We definitely have seen that increase in the last few weeks, and that would make sense when all of the messaging is around reopening It's not only around expanding the different business sectors that are open to customers, but it's also the messaging has included some awareness that people will be starting to expand their social circles as well. So that means that we have had clusters of cases where people have connected multiple households together to travel together for a weekend away, or have other such social contacts like that. It's human nature, I think, to expect that the people who might be more risky to someone would be strangers, and that the people that they would feel are more safe would be people that they know, especially family and friends. The fact of the matter for this infection, however, is that the people that you know that you're family and friends with, while you may be less likely to wear face coverings, et cetera, with them, those are the people who probably are more likely to infect you because they're going to be closer to you in your personal space, and usually you're going to be interacting with them for a longer period of time than, for example, in the business sector. So it's been more that social component of reopening that we think has been linked, because the work sites that we are seeing are work sites that have been open prior to the reopening. Question folks have asked us a lot over the last few days is, when we do our case investigation, have we seen that a number of the new cases have been present at some of the larger protests in the last few weeks? The answer is no. We still have just a very small handful of folks who did say that during their infectious period that they were at a protest. Most often when people have been out in social settings where other people may have been exposed, it's prior to them becoming symptomatic. I do think that folks do a good job on the whole that we've seen across our whole county and all communities, staying home when they're sick. But as we all know, there are cases where people don't have symptoms or they have very mild symptoms. And we do think that people are probably infectious a day or two before they develop symptoms. So that is a concern. I think that that's what we know. I would say that there are a significant set of communities that are having clusters right now. So compared to the size of their population, and I'd say specifically ethnic communities, immigrant and refugee communities, there's a higher rate right now, and those are the communities that I've described. It's not certainly exclusive to one community. There's multiple communities. There isn't any community, white or any other race or ethnicity, that has a very low case rate. All communities are having cases increase, but there are certainly some clusters in specific immigrant communities. We'll be reaching out over the next few days, now that we've identified those, to talk with community leadership, to engage some of the culturally specific community-based organizations and our own community health workers, as well as other outreach and health worker staff, to spread the word among communities, make sure that folks know the information they need, that they have face coverings if they need them, that we can help try to carry that message about ways to socialize more safely. For example, outdoors versus indoors, being thoughtful about your elders or the people who have some chronic health diseases and how we can protect them, especially as we start to socialize more. So we'd be happy to share information about which specific communities we're seeing the rise in once we've been able to talk to those communities themselves. So probably later this week we could do that. We are definitely seeing an increase in the Mid-County area in a couple different zip codes. That is information that the Oregon Health Authority does share publicly on their zip code map. And that overlaps definitely with some of the communities that we're seeing increases in. So again, I think the goal for us over the next few days is to really try to do some focused strategies of outreach and engagement and education with people. So with that, I think I will stop and see if Jen has more pieces to add, Dr. Vines, otherwise we can take questions directly.
Yeah, thank you, Kim. I think we can go to questions.
Just a reminder that folks can just unmute themselves and ask their questions. There's a hinky a standard Zoom message that says, email me your questions. Please disregard and ask your own questions.
Hi, this is Kelly Ozair from K2 News. If you guys can hear me, I have a question. I'm assuming you can, so I'm going to go for it. We're curious about these rises in numbers of cases in Multnomah County. Does it have anything to do with us actually testing more people, or do you think that the cases are truly on the rise?
Good question. I meant to cover that, so thank you for asking. That's an important question. We have seen an increase in testing in the last couple of weeks, and we've seen that increase among all different racial and ethnic groups. But at the same time, we've seen a higher increase in the level of positivity, meaning of all the tests that are done, what portion of those actually end up with a positive result. That's increased significantly. That's true across the state as well, not just Multnomah County. And so because of that increase in positivity as well as testing, we do presume that it is not attributable just to testing alone. The good side of, and this is why we would never use just one metric or just 1 week of increases in order to make policy decisions. If we all do a good job focusing our testing, particularly on testing folks at highest risk, then that could be considered a positive that we see an increase in the positivity rate, because it would mean we were appropriately focusing our resources and that we're doing a good job tracking like actually where there are pockets of disease and where testing would be more beneficial. But I do think overall right now that we're seeing it across the board enough to say that the testing is helping us identify folks, which is good because then we can do that contact tracing and help them quarantine and isolate. But that is not in and of itself enough of an explanation for the increase.
Thank you. And I have one other question. I hear that you guys are saying that the spread seems to be more around, families getting together, close social gatherings. Obviously, this past weekend was Father's Day weekend. And with the reopening, I think people took that as a green light to get their families together. Do you have any concerns that these case numbers will continue to rise, especially with the reopening? And what can we do to stop that?
We have the expectation that the case numbers will continue to rise. I think that we've expected all along that we did such a fantastic job collectively suppressing the transmission of illness through the spring. And we did that successfully to make sure that we didn't overwhelm the hospitals, that we did think that when we did start to reopen, we would probably see a little bit more of that increase that we pretty effectively minimized during the spring, knowing that it's unavoidable. The decisions to reopen, whether it's been national decision, the governor's decision, our own county chair decision, have all really been taking into account the whole time that the trade-offs in terms of social isolation, in terms of business security, in terms of people's economic viability and their families with job loss, the only metric can't just be the COVID-19 case numbers. It's got to be those other sets of metrics that we also have. And so it's a risk that we knew that we would take when we reopened to see an increase. We haven't been surprised. I think that the pieces that we need to all focus on are, again, that idea that it may feel uncomfortable or awkward to wear face coverings or masks as you are socially connecting with friends, but now would still be a good time to do that, not just when you're in the grocery store, for example. The governor's tried to speak to that with some of the orders and regulatory processes that she has to use to really try to make a strong message about the importance of face coverings and masks. I was telling a reporter earlier today, just like if you were going to a house to visit a newborn baby, you'd probably be extra careful to take your shoes off at the door or wash your hands or not attend if you were sick. It's that same kind of hygiene that's important. And then I do think that we need to especially be concerned about families that are living with folks who are older and families who are living with folks who have chronic disease. If there is somebody that's sick in a family, it's a natural tendency for all of us want to do caretaking of our family member when they're sick. But it's probably pretty important at this point to be thoughtful about assigning one person in the family to do the caretaking of the ill person and to have the other people in the household try to stay out of that person's room to the extent possible. Have that person not be in the kitchen as they're recovering, but sort of stay isolated within the household. Go ahead and use the face coverings in the household, and then just be really impeccable about hand washing too. We do want to protect really the people who are most vulnerable from severe illness. That's the main goal at the end of the day.
So I have another question about protecting vulnerable people from severe illness. This is Amelia Templeton with OPB. Multnomah County has seen really devastating outbreaks in nursing homes, and I know there's been a fair amount of sort of regulation at the state level of, intended to keep people in nursing homes from having unnecessary contact with the outside world. But I'm just wondering, as Multnomah County reopens, is there anything that you would remind people about, or is there anything further that we can do to protect residents in the facilities?
Thank you. This is Jennifer Vines responding. I think what Kim just said about sort of doing what you would do for a newborn baby, having that same kind of approach for going to visit someone who is elderly and in a long-term care facility. You should absolutely be well. You should absolutely have your face covered and have really, really good hand hygiene, and really consider having your visit outdoors if that's possible, and maintaining the 6-foot distance. Those would all be super important, knowing just how fragile some of those residents are and how quickly it can spread in those settings.
I have a question about contact tracing. This is Julia Silverman from Portland Monthly. I wonder if you could tell us a little bit about the percentages of people that contact tracers have been able to reach, and just some of the sort of challenges that are incumbent on trying to successfully trace and isolate and contact those who have been exposed to those who have tested positive. Thank you.
Sure, we've been able to reach 80 to 90% so far of the people that are cases or presumptive cases that we're investigating. Like I said, people do, it's uncomfortable to get a call from folks you don't know who are asking lots of questions, but I think people understand the intention is to help keep those folks, households and family members and coworkers safe. So just like for any other disease, people are usually generally pretty helpful and collaborative with us to give us the information that we need. We definitely see the challenge for people when we ask them to quarantine or isolate and stay out of work for 2 weeks, stay home. That can really be pressure on a family in terms of income. It can be pressure in terms of food security, in terms of paying their rent. It can create childcare challenges, etc. So we have multiple contracts that we're standing up with community-based organizations to try to help provide wraparound services to those cases and those households to be able to provide some like emergency rental assistance, food security, hygiene products that they need, and emotional support. It's scary for people. People are afraid to get the rest of their house sick. We also do have opportunities to help people if they do live in a large group household and they need to isolate outside of that household. We have medical motel where people can stay during that time, and we've got some other options we're exploring in terms of other ways that we can help shelter people. We're exploring RV or Airbnb. What are some other options to really expand the isolation capacity that we have for sheltering people? I guess I would say another challenge is we are hiring multilingual staff, and that's a lot of staff training that has to happen, but we're doing a good job at that. And I think that one of the lags in time is not really not having staff that are a good fit, but it's just the natural lag in someone gets infected, then it's a few days before they develop symptoms, then it's a couple days before they get in for a test, then it's a couple days before the test is resulted and reported to us, and then we're really trying to call them within that first 24 hours. But by then there's a good few days, and by the time we get to reach them, sometimes there's already been household exposure. If someone doesn't have symptoms, they have been back to work. So sometimes our ways that we try to interrupt disease transmission, just by the nature of the timeline of how things work, we don't always interrupt it just as immediately as would be ideal. We try to strategize to do the quality improvements we can to get that system to work as fast as possible, but there's just inherent delay in some of that.
Thank you. And just to clarify, that 80 to 90%, is that for people who have had a test and are positive? Because my question was really more about their contacts, like how successful you guys have been at being able to follow up with those who they've been in touch with. Does that make sense?
Yes, thank you. I don't actually have a quantifiable number to give you, although that's something that I can look up and get back to folks on. Earlier on, before there was as much opening, the number of contacts that we had to notify outside of households was actually usually very small because people were really isolating as soon as they had a first sign of illness. I think that it's been a little bit harder to reach contacts, but usually because people still aren't in large group settings, those contacts, they usually do the know a name, a phone number, and can give us some good locating information.
This is Galen Etlin at KGW. I'm curious if you can give us some context around the outlook of hospitalizations in Multnomah County. as we continue to see numbers rise?
Sure. Thank you. This is Jennifer Vines responding. So we reopened last Friday after having scrutinized our hospitalizations, which the context for that is a county population of over 800,000. Our hospitalization numbers had been somewhere between 9 and 14 per week. The state releases those numbers on Wednesdays, so I don't know what this next week will bring. I am in frequent contact with our health systems, and bed availability, hospital capacity, even if it's just anecdotal, that information is flowing freely. So that just again speaks to our broader goal of trying to keep people from being hospitalized, trying to keep our health systems from being overwhelmed, but recognizing that as people go about their lives more and more, even with precautions, this virus will spread. And it will make some people very ill.
Just to follow up, does that mean that we are in an okay zone right now? What is the outlook as you look ahead and as we see this trend going upward slightly?
I would say, at least for the past month, we've been okay. And it's a measure both in terms of hospitalizations and hospital capacity that we're going to be watching very closely. Again, having seen how the virus could spread very quickly and overwhelm health systems very quickly, it's something that we're going to be paying, I think, very, very close attention to for the foreseeable future.
Thank you.
And Dr. Vines, this is Kelly Ozair from K2 News. I had just another question for you. When it comes to, sorry, let me start over. We're seeing a number of cases pop up here in Multnomah County, but can you put into context for us how Multnomah County compares really to other hotspots? Are we considered a high risk area, or where do we fall in that grouping?
That's a great question, Kelly. I don't know. I'd have to look around to find a sort of comparable jurisdictions. And Kim, I don't know if you have an immediate answer to that. I'd have to think more about sort of where we stand compared to another county or another jurisdiction or another set of circumstances that would be helpful. Kim, do you have any insight into that question?
I know in general, when we compare county statistics, there's a set of comparable counties in terms of urban size, density, et cetera. I have not checked recently on how they're doing with COVID-19 data specifically, but that is something that we definitely can look at. I know that Oregon and Multnomah County within Oregon as an urban area has so far had relatively low rates compared to others, and we'll see what the next month brings.
I guess maybe that's my question. Sorry, it's a little frazzled, I realize. When people see these numbers, should they be extremely concerned that we're headed back into a bad direction, or do we have time to pivot and fix it?
I think, and I'll let Kim chime in again, an attention grabbing, 80 some cases reported over the weekend. Multnomah County was down to 17 today. I think this day-to-day look at the numbers is a bit of a roller coaster for people emotionally. I think, again, we expect the numbers to go up. We know some people sadly will get hospitalized and potentially die of this virus. We're trying to keep that to a minimum with the tools that we have. But by far the most important tool is what each individual does every day, especially with their close household and work and social network contacts. So I think we're watching indicators that are going to have to be looked at, I think probably more through a slightly longer term lens, even though this virus spreads quickly. I think the day-to-day forecasting is very tricky to do. And I don't know if Kim has more to say about that.
Yeah, I would agree with that. As much as we're trying to be very responsive, like Dr. Vines talked about, keeping a very close eye on hospital capacity, jumping on any outbreak as fast as possible, we're also in it for the long game. And I think that the emotional roller coaster of the population being able to deal with headlines about a specific day and then the specific next day looks better, does everyone breathe a sigh of relief, exhausts folks and probably clouds the message a little bit. we're definitely paying attention, and this isn't completely unexpected.
Thank you.
Hi, this is Brad.
Hi,
Oh,
this is
go ahead.
Rachel Shanahan from Willamette Week. I am wondering, like, why you're saying this case increases expected, given that we only reopened at the end of last week.
I think, Rachel, this is a virus that spreads easily. We know people can have the virus and not show symptoms. I think it's a spread, we know, through close and prolonged contact. So we've been predicting that this virus would spread. It spread even when we were in quote unquote lockdown. And so we are in what's called mitigation, which is trying to prevent the worst of it. And the worst of it, as we keep saying, is hospitalizations, health system overwhelm, and preventable deaths. So again, for a virus that spreads as quickly and as easily as this virus, I'm afraid we're left with damage control, so to speak.
I understand that, but you've repeated on this call that this was an expected increase. So I'm confused about why you would attribute that to reopening at this point, and whether we should expect much larger numbers in the coming weeks if you're saying reopening will result, maybe predictably result in a larger case count.
I see. Sure. Thank you. So I think reopening, it's of course too soon to say if these cases are related to Multnomah County's formal reopening on Friday. I think as conversations started about reopening, as we headed into summer, as people had understandable fatigue around what we were asking of them, which was pretty extreme, I think we expected people to start mixing more. We knew that some industries were going to continue as essential work sites. And as the virus finds its way into these work sites, into social networks, we know that it can and will spread. So Kim, anything to add?
Yeah, I would agree with that. It's not necessarily, we certainly haven't seen, and it's too early to expect that we would see, we've seen clusters in restaurants because now they have indoor seating, for example. That's not what we're saying. We're saying it's that social connection. I think that happened over Memorial Day weekend. And I do also want to say that some of these work sites that we're seeing the spread, that spread has been going along slowly, and it just amplifies as cases add up over time. But that's been going on slowly, probably in some work sites since April or May. Those are essential services, so they haven't been closed at all. And we've been tracking outbreaks among those types of workplaces since March.
Do you have two updates on two numbers, which is the percentage of cases that are traceable to another case? Has that increased at all since last week, when it was just half of cases you could identify another case that it could be traced to? And how about the percentage of tests that by race and ethnicity? Is the county improving on those metrics for testing, Black Portlanders, Latinx Portlanders, other groups?
The percentage of cases that are traceable to a cluster or outbreak or source and not what we call sporadic is it's a little bit complicated to calculate, and it's the Oregon Health Authority that does that calculation. They do it every Tuesday, Wednesday, and release it by Wednesday evening or Thursday morning each week. So we don't have an update since last week for that, either for the state or the county. In terms of the numbers of tests among non-white folks, among Black, Indigenous, other people of color communities, we have seen those testing numbers increase across the board, and that's been great. OHSU recently, their Expo Center drive-through testing, they recently expanded that testing to include a number of different groups, whether or not they have symptoms, according to recent changes in the Oregon Health Authority testing guidance. So folks who are English as second language, who have any kind of self-identified disability, communities of color, can seek testing. That is one site of many that they can go to that I know has expanded their testing capacity. In the last few weeks, we've opened up drive-through testing. We've also worked with community partners to stand up some culturally specific testing. So we did that with the African-American community, the Black community, with partner SEI and some other community partners. And just this past weekend, we had another successful testing event with Pacific Islander and Native American community as well. So I think that people are seeking testing. Testing becomes more available. Hopefully any healthcare providers seeing this will understand that we're not just trying to test people who are severely ill. We're trying to test anyone who has mild symptoms. We're also referring contacts now into testing, which we weren't doing before. We were talking about quarantine, but not about trying to rapidly access testing so that we could do that next level of contact tracing. That's something we've also changed in the last couple of weeks.
Hi, it's Brad Schmidt from the Oregonian. I wanted to follow up on your comments about the tight, cohesive social networks. I tried to do a quick tally, and it looks like there's been 293 cases in Multnomah County over the past week that have been reported by OHA. How many of those 293 fall within spread within these tight, cohesive social networks that you guys were talking about?
I can't give you a specific percentage, but I would say the majority do.
And how many specific outbreaks have there been among these tight, cohesive social networks? I mean, what's the largest outbreak, for instance? 18 people, 25 people that are all linked together? How does that work?
If it's a setting like a congregate facility, a work site, we tend to use the word outbreak. If it's a social network, we will often use the word cluster at first. So most of our work site settings have 10 or fewer cases or presumptive cases in total. Sometimes they trickle in. Places where the employer is pretty fast to set up testing access for the rest of the employees, then we would feel more confident that that was actually capturing the cases that exist. Some places, the rest of the employees haven't been tested, and so we have a little bit of an unknown about what the true case count is in some of those outbreaks.
If I could clarify, I'm sorry, I just mean, what is the largest cluster then? Among the social gatherings that you're discussing, what's been the largest cluster of cases?
I would have to look and ask our communicable disease team what the largest number is. I know we're dealing with households sometimes and close networks of 5, 10, 15 folks. I'll have to look and let you know what is the largest number of people that we've defined actual points of contact between family or social network.
Just to be clear, is Multnomah County, and Kate's on the phone so she can follow up, but are you guys willing to release for the past week of I think it's 293 total cases, will you release the total number of cluster identified cases through these social gatherings and then the largest number associated with a single cluster? Is that something you guys will release?
I need to talk to the CD team and to Dr. Vines about that, and Rachel Banks, who's our local public health authority. She's actually the ultimate decision maker about what kind of data from our reportable disease database we release and what level of granularity that we release to the press. Okay,
and then following up on that, are these these clusters distinctly different from the ethnic and refugee communities that you guys referenced, or are they one and the same?
Well, we are certainly seeing cases among white people as well. So we are not seeing any story here that points in one direction of one type of employee, one specific community. We're just seeing an increase in the number of folks we identify in households. Part of what I should say as well is that our case investigation, our case definition changed in May throughout the state, so that if someone is a close contact to a case and they have symptoms, we're counting them as a presumptive case, even if they never get a test. So some of this are maybe that in the past couple months prior to that, we would have had household members that wouldn't have gotten counted as cases, whereas now that they do. But I definitely think that we're seeing an increase in those larger family settings with multi-generations. Primarily, the increases we're concerned about are more in a variety of different immigrant communities, and for a variety of reasons. In part, people of color, as we've talked about in many different conversations with the media and with communities, there are disparities for chronic diseases, and those chronic diseases concern us. Those disparities that have been long-standing, and those are really based for long-term structural regions of racism. Those are the things that make people have more severe illness, and so that's ultimately what we're really concerned about. So we've had that concern layered on top of that, and this is the same as we saw throughout the rest of the country, layered on top of that, there are differences in the types of employment different groups of folks have access to, including some folks that are essential employees that work close that do not have the option to telework in their job, right? So there's different levels of risk that are layering on top of each other. And then there's also just the community dynamics of socializing. So it's all of those adding up together that give us concern.
Certainly, and just to follow up on that, sorry, but you guys have had Black, Indigenous, and people of color have outperformed, unfortunately, whites in infections for the past 6 weeks. And so I guess I just want to be clear, are these new ethnic and refugee groups that have only popped up in the past week? And can you identify them? I know you guys said that you plan to later, but given that you've already sort of let the cat out of the bag here, can you identify which specific groups they are? And can you also quantify, again, if we're talking about 293 cases over the past week, is this 50% of the new cases are within, 3 specific minority/refugee groups, and those are blank? Like, can you give us some specificity here about what we're talking about?
I can't give you a specific percentage that are linked to specific different ethnic groups. I can tell you we're talking about 7 or 8 different distinct immigrant, refugee, and ethnic populations. I was pretty clear, and I'm not going to change my mind right now, that the way that we have been operating so far is try to operate really collaboratively and transparently with communities and with community leadership, whether that's releasing data before we release it to mainstream media and or connecting with people to try to get the word out to communities. We'd really rather have folks hear it internally from trusted partners about their own community when it has that impact. And that's just our commitment to the approach that we've had to racial equity work.
And just final, I promise this is the final, but in terms of racial equity work, again, it's been 6 weeks where you've had people of color leading for net infections in the county, and these all appear to be recent infections that you're bringing up now. So could you maybe give yourself a grade on how effectively you've done at reaching these communities if you are now seeing outbreaks in these communities in spite of the efforts that you've put forward? I mean, shouldn't there have been more effort to reach these communities before now if you're starting to see the outbreaks there?
I think that we have been doing a good job in a lot of ways with sharing information right from the start in multiple languages. In March, we trained up extensive number of community health workers from a variety of different culturally specific communities that have multilingual capacity so that we could start to get the information out. I think we've been mindful about trying to distribute face coverings and other resources to community organizations, not just to healthcare providers. I think we've done a good job from the chair to the chair staff to our own public health director to engage with communities of color leadership to try to strategize together. I think that we always, as a county government, have ways that we structurally are very white dominant culture oriented, and we'll continue to need to make progress and move forward on that. I think that we are doing a good job hiring a diverse group of folks, and we are getting contracts out to the community. I think that there's some of those pieces we could have done a little bit earlier and a little bit faster so that the community had a little bit more time to staff up and have that community component to the community health workers and wraparound services. So I do want to be transparent about some of those things that I feel like we could have been a little bit faster on. Some of that is just government bureaucracy, and some of that is just one, we're all working as hard as we can, and 2, some of it is just that we've needed to change strategies multiple times as we've learned more information about the disease and the science of the disease. I think if you all remember, we thought it would come from travelers first. It didn't in our area. We didn't understand at first how much asymptomatic spread there might be. I can think of other examples as well. Dr. Vines, I don't know if you have some other input you'd want to add on some of the pieces I feel like we've been proud of, pieces maybe we've been weak and that we need to improve.
Yeah, I think it's a really fair question. I think I would use this question to say that, as I've said before, this pandemic shines a spotlight on so many structural issues that we have, from racism to how people work, how they live, what their options are for childcare. We can't undo decades and centuries worth of structural issues, but we can adapt our public health response to center the most vulnerable to the extent and to the best of our abilities. And so in that sense, I do think we've done that. It also, again, I'll be honest, public health, even the practice of medicine has a very spotty history with people of color, with Indigenous, with African Americans. And so to rebuild that trust doesn't happen in 6 weeks, but I would say we are really making an effort.
This is Amelia with OPB. We've seen that, we focus a lot on workplace transmission and going to the grocery store, but the transmission within families and within households is a really major factor in driving spread of this virus. And I'm just wondering, does the county have any goals or any targets around, once you know that somebody is sick, reducing transmission within that person's family and household?
Yeah, we've talked a little bit today so far on strategies to help people understand what's highest risk for transmission and what's not. So it's not only covering people's mouth and nose, but it's the washing of hands, washing of high touch surfaces where if people cough, those droplets can land. Sometimes it's about getting folks resources they need. Grocery stores were out of disinfectant cleaning products for a while, right? Face coverings sometimes are hard to come by, hard to afford for folks. So there's some of those components. I know that a lot of people would not consider moving out while they're ill. And sometimes by the time we check in with them, their household contacts have already frankly been exposed because they've been infectious for a few days. But some people have been putting themselves in motels, sleeping in a tent in the backyard while they're sick because they are really concerned about some of the other members of this household. And so we have expanded the medical motels that we were using originally in case anyone in the homeless shelters got ill, to be able to move them out of those shelters. And we want to have that same kind of capacity for supporting people for sheltering with isolation and quarantine if they do choose it, and it's voluntary. Yeah.
And I think we'll take one more question, and then
Hi. I had
more questions.
assistant Phil Monahan from Willamette Week. I had a couple quick data questions. How many people do you have in medical motels at this point? And how many cases have been traced to childcare settings at this point? And then my broader question is, are there, you evaluated how you've done going back, are there policy changes that the county is looking to enact to prevent case increases in the future?
We haven't had significant concern about spread in childcare. Childcare has been limited for the past number of months, so we'll see if that changes. Fewer than 100 people, I believe, are currently occupying our medical motels. And I'm not in a position to speak to policy changes that the county is considering. Don't know if I want to put that to Dr. Vines.
No, again, I think it's a good question. I think it's Monday after a busy weekend and after reopening. And as you all know, and as Kim has said, we adjust course as we need to. So again, we're having to respond and adapt at the same time. And so we appreciate the chance to speak directly to you about those efforts, knowing that we may be back saying something different in the next few weeks.
And thank you. I did want to just step in right before we get off. I know Lizzie Acker with the Oregonian is on the phone and just had one question if she could. Lizzie, can you?
Thank you so much. Thank you so much. Sorry about that. I kept trying unmuting and muting. I was just wondering, Dr. Vines, if you could respond to people in the community who are saying that asking them to wear a mask impinges on their personal freedom.
I think I would say, covering your nose and mouth is relatively low burden for the person having to do it. There are exceptions, of course, young children, people with underlying health conditions that already make it hard for them to breathe. But this is a basic courtesy towards other people, some of whom you may know well. Again, your social close social networks, and some of whom you may not. So in the same way that I think the social norm would not be to cough on your hand and then extend it to someone to shake their hand, I think my hope is that we move to more of a sense that wearing a face covering is something that you do for others. And in fact, one that's well made actually helps protect you. So that's what I would say.
Perfect. Thank you so much. Thank you so much.
And thank you all for joining us today. I appreciate you taking out the time, and thank you, Kim Taves and Dr. Vines. Please follow up with Julie or I if you have any further questions. Thank you so much for joining us, and everyone be well.